Hello, everyone. So, my presentation is on childhood infectious diseases, specifically pertussis and whooping cough disease. So, pertussis is also known as whooping cough. It's a highly contagious bacterial disease that can be spread by coughing. It's a respiratory illness that's caused by a type of bacteria called Bordetella pertussis, and the disease is actually only found in humans. And this is a picture that was generated by the computer of how this actual bacteria would look like inside of our bodies. So, how does it form in humans? Whooping cough bacteria attaches to the cilia, which are tiny hair like extensions that line part of the upper respiratory system. And the bacteria release toxins or poisons, which damage the cilia and then cause the airways to swell. Some symptoms look like a common cold, so that's usually what it looks like at first. And then there's early and later symptoms. Early symptoms can usually last for 1 to 2 weeks and usually include runny noses, low grade fevers, and mild coughs as well. It usually takes about 5 to 10 days for symptoms to appear after exposure to the bacteria that cause whooping cough, and sometimes symptoms don't even develop for as long as 3 weeks. So these later symptoms include, which is how you'll know that they do have pertussis or whooping cough, is when the person begins to have these coughing fits. And so these coughing fits, usually 1 to 2 weeks after the first symptom starts, they start to develop these coughing fits. They usually last 1 to 6 weeks, but can last for up to 10 weeks. The cough generally gets worse and becomes more common as the illness continues. So, coughing fits cause people to make a high pitched whoop when they inhale after a coughing fit. So, that's where it gets the name whooping cough. It could also cause people to vomit during or after these coughing fits. They feel very tired after a coughing fit. They also can have difficulty sleeping at night, struggling to breathe, and sometimes people can cough so hard that they actually fracture or break a rib. So, those are some of the later symptoms that we see. So, I just wanted to include this chart from the CDC that just gives a good picture of whooping cough disease progression. So, as you see, within the first 2 weeks, we have those early symptoms. They are highly contagious. So, anybody that is in close contact with somebody who has whooping cough, for example, if they cough on them, the person doesn't cover their arm, that can lead to somebody else also developing whooping cough. After the second week, this is stage 2. So the later symptoms, like I said, they last 1 to 6 weeks. And so that consists of those coughing fits that I mentioned. And so that can last a really long time. And then last is our recovery stage, which lasts about 2 to 3 weeks. So they're susceptible to other respiratory infections for many months. Recovery is gradual, and then coughing lessens, but fits of coughing may return after that. So the recovery can be slow, with the cough becoming milder and less common over time. And then coughing fits may stop for a while, but like I said, can return with other infections. So, what should a teacher do? If a teacher becomes aware of a suspected or confirmed case in school, they need to notify public health officials within 1 business day. So, that's super important that they don't wait and that they report that right away. And when should students with pertussis be excluded from school? So students should only be excluded from school only if it is necessary. And so those who have been diagnosed with pertussis should do the following until completion of 5 full days of appropriate antibiotics or until 21 days have passed since the cough onset. So they should abstain from any sort of work, social activities, sports, or in person classes. So, this is once they actually have been diagnosed. And again, this is after 5 full days of antibiotics or until 21 days have passed since the first cough onset. And then I included this chart that talks about school and activities exclusion recommendations. And I really just want to highlight the right side of the chart because this is where it shows when students are excluded from school. So you'll see on the right side, it says exclude in bold, the last two right columns. And again, that's when pertussis is suspected, cough duration is 3 weeks or less, but they should be excluded from school until pertussis ruled out by lab test or 5 days of antibiotics are completed. And then at the bottom, we see that this is without antibiotics, so they're not prescribed. So exclude student until pertussis is ruled out again by a test, and then if the test is positive, to start treatment and exclude until 5 days of antibiotics are completed. So usually it only they should be excluded from school only if it is absolutely necessary. So most of the time, students are vaccinated or they will get antibiotics and get medicine right away. So that's usually they're excluded from school if necessary. And then what to expect when a case of pertussis is confirmed: notify and make recommendations for those who are exposed. So there's different recommendations that I researched. So initial notifications in an academic setting are mostly recommended only if a case of pertussis is lab confirmed or been clinically diagnosed. Public health has template letters that they can share for a variety of situations in different languages. So this includes letters for a classroom when there's only 1 or 2 cases, letters for the classroom when there's 3 or more, and letters for schools to promote more awareness if a large amount of students have been or if they are positive for pertussis or whooping cough. And so generally, public health does not recommend antibiotics for those who have been exposed in a classroom or activity setting. Preventative antibiotics are limited to those who are household-like contacts or overnight guests of a case while they were infectious. And so usually it just depends on how many people were exposed. And usually, yeah, if there's more than one, then they recommend to send home letters to parents and families. And then some strategies. So, like I said, students get excluded from school if it's necessary. And if that is the case, then teachers can do virtual check ins, send home asynchronous material. If a student isn't able to do asynchronous work, then they can hopefully get a loaner computer if the school allows it, if that's a issue for them to do asynchronous work. And so just the teacher checking in with the student to make sure that they're okay, checking in with the parents, and then providing this asynchronous material so that the student doesn't get so behind in schoolwork. And then lastly are my references.